Hello, we're here again at the Policy Lab, and today we're going to talk about the drug decriminalization. I have wonderful guests here today. I have my professor here, Dr. Emrul Hasan. He teaches at Vancouver School of Economics and also the School of Public Policy at UBC. And next to him, I have Erica McAdam. Erica is a PhD student at the University of British Columbia and has a master's in public policy and bachelor's of arts, honors in law. And Erica is also a trainee at BC Center of Substance Use, and her research focuses on evaluating the impacts of innovative policy responses to the overdose crisis, including decriminalization of personal possession on young people and who basically use unregulated drugs. Next to Erica, we have Dr. Galib Bhayani is a former chief superintendent of the RCMP in Metro Vancouver, served as the chief of police in North Vancouver as well, sort of where I live as well. I live in West Van, so yeah. And he currently leads the safety and risk services at SFU and holds a doctorate in community policing with over 30 years of public safety experience. Sure, he's going to have a lot to share when it comes to the law enforcement. And lastly, we have Amanda here. And Amanda is joining us virtually from Edmonton, if I'm not mistaken. Is that correct?
Yeah, Edmonton.
Yes. And Amanda is a counselor, is a certified counselor by the Canadian Addiction Counselors and as an addiction counselor, actually. She received her addiction and community support worker diploma from VCC and is also a two-time published author of Mothering and Sex Trade and Releasing Hope. And Amanda has over a decade experience working with men and women in addiction, from the front lines to facilitating groups in community events through trauma-informed lenses. And Amanda was the recipient of Courage to Come Back Award 2030 in addiction category. She is passionate about advocating recovery for everyone. Now, as you see, we have a great mix when it comes to talking about decriminalization. And this topic, personally, I'm not the best person to know everything about, but what I do understand is that on paper, it looks like decriminalization makes sense on a macro level. But then if it's just one piece without the next steps that we have to take, it's going to feel like a half-measure situation that we have in BC as a pilot program. So from the beginning, I want everyone to just state where they are on the spectrum of decriminalization. So I'll start with you, Galib. Let's say if you have to choose between decriminalization and keeping it as criminal offense, where do you see yourself?
So that is a really difficult question to answer, coming from a policing background and also in an education field here, trying to resolve or work with my students around social issues, intersectionality of our healthcare system. I'll start by saying that drugs are not a criminal issue in my lens. They are a healthcare issue, and they belong in the health sector. And I'm talking about regulated drugs. And when we talk about drugs, we talk about all the different things, everything from cocaine, crack, fentanyl, all those things. Where I see the challenges are, it's in policy, and this is what we're going to be talking about today, is the gaps in policy. When we create policy, we don't consult all the way downstream to all the different people that we need to talk to when government creates this policy. And so I'll give our other guests here a chance to say, I do think there's room for decriminalization. Certain things, certain amounts, if we have all the systems in place and we have the connections to support those that are in crisis. And I'll stop there to give others a chance here, but yeah, there's a lot to talk about here today.
Erica?
As a researcher who focuses on decriminalization, I have to unequivocally say that I'm obviously very supportive of this policy. Oh, thanks, Amanda. Sorry about that. Yeah, I'm very unequivocally supportive of decriminalization as a policy. We have decades of research evidence that show the harms of criminalization, and it leads to very preventable harms in our society, both on the individual and community-wide level. Things like the over-incarceration of Black and Indigenous people. It allows for the widespread stigmatization of substance use. And there's also drug market effects, as in the criminalization environment, we've created a black market where there's no regulation taking place, which is the root cause of the ongoing overdose crisis. So I'm quite supportive of decriminalization. It's a very small step towards undoing some of the harm that we see that comes from the criminalization and prohibition frameworks.
Okay.
And I think maybe I'll leave it there.
Dr. Emrul, go on.
Okay, so my work is mostly around economics, right? So this is where I'm probably most to learn. But we know that as an economist, I often work with City of Vancouver and City of Surrey in their policies around sports. And in our sports field, we see a lot of, it does get affected by drug use also in many cases. So my focus would be mostly on allocating resources. That's what it's very important. Like, for example, this is a long word for me. I just call this decrim. So
yes, that's actually the way that it's.
I mean, exactly how this is beneficial for our city or maybe for our country in total, and how maybe the money can be allocated to something else. That's pretty much what I'm here to contribute to, and how to design different incentives to make sure that the healthcare sector is there, and at the same time the public is aware of the bad effects. Because personal story is that I got affected by 2023 also. I was working long hours, and it's a personal story, but it's important.
So let's say that I know that you said that you're not as educated as the rest of the panel on that specific topic. Let's say you want to say decriminalize or not, and you have to choose, and the City of Vancouver's mayor is here, and you're the only one who Ken Sim is going to listen to. Decrim or not?
So my answer is very simple, like everyone is. Obviously decrim. Okay. Because what got me through my 2023 was not punishment, right? It was education, it was support, and it was the system that helped me to get out of it, right? Okay. So you know me for 3 years almost. You have seen all the changes in me, from the worst situation to some of the best situations. So this is where I'm obviously supporting decrim, and then I will try to explain from an economist perspective how that makes sense.
And Amanda, go on.
Oh, well, I that's not like a yes/no question for me. There's like I look at the key features regarding like the drug decriminalization, like the small amounts of illicit drugs, allowed to have like 2 grams, and looking at it from a healthcare. So shifting from a criminal justice to public health approach. I get that, I'm interested in that. It reduces stigma associated with drug use. If that's if that's a goal, I'm with that. But what I'm finding is that it comes with challenges and controversies, like safety risks, people using publicly, like in schools and on the streets, and they're normalizing it. And I feel that that's problematic. And then also the diversion that's coming with the 2.2 grams or 2.5 grams, what's happening there. I think it's changing a little bit of how drugs are being sold on the street. Mm-hmm. And that's a different movement that we can speak to after. And I think, when it comes to childcare and airports and schools and the trafficking still remains, right? Mm-hmm. So,
but again,
and when it comes
Ken Sim is listening to you. Decrim or not to? That's the question. And you have to, I understand that at the end of the day,
I think we can do better, and I believe it's a healthcare issue, not a criminality. People are sick, people are using, and people are using to stop the pain. So, no.
Perfect. So when it comes to decriminalization, because I had an opportunity to talk to different people on the ground that they don't really have the level of expertise of this panel. And one thing I've noticed is that when you say decriminalize, what people actually hear is more like commercialize, because they feel like, okay, now it's everywhere. Like I can get some opioid on the side of the street, but if it's commercialized as what they hear, I can go and get it, like at Walmart or something. So this is the feeling that usually people have. So I want to have a better understanding on that. So what does drug decriminalization mean in the context of public safety, public health, and justice? So Dr. Galib, you go on.
So let me just start with, for those that don't know about the decrim journey, I can just go back to 2016, a quick history, a snapshot of where it began. BC's provincial health officer in 2016 declared a public health emergency. People were dying at an average of 3 a day and upwards as high as 7 a day in British Columbia. Forget about Canada, just in British Columbia. In 2017, the British Columbia government recognized this is urgent, it's a crisis. And they created a brand new ministry called the British Columbia Ministry of Mental Health and Addictions, BCMMHA. Brand new ministry, poorly funded, poor mandate, not a whole lot of kind of a priority of where to go to, figure it out yourself. So that is a whole other discussion. In 2020, police de facto stopped arresting people that were possessing drugs, small personal amounts of drugs.
And what is the gram?
And that was, it could be 5 cigarettes of marijuana, it could be 1 crack of cocaine or methamphetamines. The reason why is the Public Prosecution Service of Canada, that's who prosecutes, drug offenses are federal offense in Canada. They're the Crown prosecutors that would prosecute drug offenses. They turned around and said, this is economically does not make sense for us to spend thousands of dollars or court hours for 2 grams of marijuana or 1 gram of methamphetamine. De facto, they were not accepting charges, and the police stopped charging people for personal use. Out of the thousands of arrests made that year, most of them were they were not accepted by the Crown prosecution, and only those for trafficking were advanced. So I'll say this to you: in 2020, the government decided, let's try this, let's embark on the decrim journey. And when we talk about decriminalization versus legalization, we can look at the journey of cannabis in Canada from illegal to legal. It's regulated. Decriminalization was essentially here to reduce the entry into the justice system and giving people criminal records. That's one of the biggest reasons, the stigmatization of that. Legalization is, again, for commercial purposes. Government is making money on the legalization. They're not making money on the decrim. So I think I'll give you my answer there.
On the decriminalization, what it means in the context of public safety. I think what Galib covered was the public safety and justice part of it. You may want to talk about the public health side of it.
Yeah, for sure. I mean, we have lots of research evidence that show prohibition and criminalization frameworks lead to adverse health outcomes for people who use drugs. It prevents people from going to their doctor, it prevents people from going to harm reduction services like needle exchanges, so it can exacerbate risks of acquiring HIV amongst people who inject drugs. So there's substantial evidence that from a public health perspective, criminalization is not a good policy, it's a failed policy. And I think that's really where the rationale for decriminalization comes in. I think decriminalization is a very small tool, and really what it can do is just reduce interactions with the criminal legal system for people who use drugs. It's not designed to touch anything to do with the healthcare system. You would need other interventions in order to increase access to services like that. Yeah, and just a distinction on the two, in terms of legalization, that would be the government selling the substance. So that's what, yeah.
So something like BC Liquor.
For sure, yeah. I would say even past legalization for BC Liquor, you have something called commercial promotion, where you have very few regulations. You allow the advertising of alcohol and those sorts of things. So I would say tobacco is maybe a better example of strict regulation. So we have rules about who can buy it, what the packages look like. There's
I'll come back to that.
Yeah, those sorts of things. So yeah, decriminalization is really just removing criminal penalties from people who use drugs, whereas legalization is where the government would actually regulate the substance. So 2 very different, distinct things.
Emrul?
So I always start with personal stories, right? So I'll probably focus a little bit on social justice, and we'll take the economics angle again. Right, the social justice. I come from a community. I'm originally was born in Bangladesh, so we do have quite a bit of Bangladeshis here. So I come from a community. For them, criminalization is the way to go, right? For this, so I understand social stigma really well. Even when this podcast gets published, anything can happen.
It's gonna be fun. It's gonna be fun.
It's gonna be fun, and I love those. There's no problem on those. But for me, in terms of reallocating resources, the reason decrim might also help not only public safety and health issues. For example, if your population is healthier, they're going to contribute more towards human capital of the economy. And Canada's productivity level has been pretty low over the last several years. So that might help in that way by pretty much when people are not afraid to seek help, so public health might improve. So that's one of the lenses that we can look from economist point of view. The other thing can be BC spent, I think in 2023-22, about $20 million alone on just catching small substances, what Galib was saying.
Oh, God. Okay.
$20 million we can easily invest in treatment, prevention, maybe even housing, who knows. That's another issue. So that's my lens to look at this issue.
So Amanda, when it comes to decriminalization on the ground with because you've been dealing with as a counselor, you've been dealing with many people experiencing this topic. How do they see decriminalization? Are they in support? Are they see it as a whole that is just getting deeper and deeper and there's no way out? And if now it's decriminalized, this could be even harder for them to get out.
Well, I was been on the ground like in 2016 on the Main and Hastings, Galib. We were speaking about that last night. Remember when I shared that with you? And when you're watching people dying and there's a crisis, and then people are desperate. We want to do things, and then we want to find change, and we want to reduce the numbers of overdose. We want to help people use resources, and the fear is everywhere. And also, when you think about the tax dollars going on ambulances, police, and arresting, all that, I get that part. But when it comes to, I don't know, maybe my boots to the ground, being a person with lived living experience, being in addiction for over 30 years, being incarcerated for 5 years, having my own children overdose and die, having my partner die to overdose, and seeing how it's impacted my life even 15 years later, changing my life, and how I want to be part of the solution. So I think of how can we help people live rather than die. That's where I come from. And also, I can't speak for everyone. That I have my own, I want to reduce harm. I want to reduce stigma. I want people to feel safe, to come to safe places and to get the help that they need. Do I feel that giving the drug addicts free drugs helpful? I don't know, sure, maybe if they're unsheltered and it's cold out and they do a bump of speed, it'll keep them warm and awake all night so they're not getting robbed or violated or this and that. Like, there are so many, I'm working with drug users. I was on a project with them, drug users, drug war survivors, coming from their lens. And even when we had COVID, and then I didn't know that my own car was going to be a health ban, and I was kicking up tables while every other resources were being shut down, and people didn't have nowhere to go. And I was making sandwiches, handing out naloxone kits, getting safe places, and renting a church so people can use the bathroom, wash their hands, and have a meal. So I come from that place. I think when it comes to legalizing, what do I have here?
We're not there yet, though. On the legalization, we're not there yet. But I definitely.
Decriminalization can reduce harm and stigma, but it does not address supply safety or drug regulation.
Yeah.
Right. That's
absolutely
how I feel about that. And so when you're with the people and trying to support them with their daily needs, and when they're afraid and they're helping each of their friends to stay alive, you get a different perspective.
Yeah, for sure. Some personal dilemma that I have is that when it comes to individual rights, I'm like, government, just get the hell out of here. I don't want to deal with you. But then at the same time, you want to make sure that you balance what is good for the society versus what you personally want to have. With that being said, should personal autonomy override collective concerns on drug safety and access? So let's say if I want to have some dosage of, I don't know, crack or opioid, do I have the right to have access to that in a safe way? Or is it just something that has to outright not even within the realm of possibility? So Amanda, I want to start here with you.
So you're asking, do I have the right to use drugs?
Yes.
Well, we're given free will, like we have, right? But when you're asking, okay, in a right mind, in a right state of mind, right? What about asking a person who's been unsheltered, who's malnourished, who is maybe had several overdoses, right? And you're asking them, like, do I have the right? Yeah, you have the right to put anything in your body. That's the sad part, right? But also, I would like when people are sick and they're not thinking right and they're like insane, if you will, as a person that's in right mind, that's in community, that's how do we support people and be responsible to help those when they're coming out of the hospital, say emergency, and they're going into withdrawal, and you're asking them, oh yeah, should I just give you drugs so you can get back to doing what you're doing? I think like for me, using drugs, having the right to use drugs, and then using drugs to stop the pain. I don't think everybody wants to be downtown on the east side getting in line and like that quality of life. I can't, for me, if I'm going to use drugs, and I came from a different era where I used hard and I went to any lengths to get what I needed. And I think if somebody was giving me drugs and it was free and it was there and it was available, I think it would be keeping me sick. It'd be keeping me stuck. Like enabled.
Would you have
maybe,
the same?
perhaps.
I'm not sure to what extent you have the same feeling about alcohol.
Alcohol kills.
Okay, so do you
Yeah,
think
it's socially
that as
acceptable. But you're comparing apples and oranges.
I understand, but I just
Yeah.
want to make sure that when we say someone has the right to go to a BC liquor store and grab a bottle of vodka, can we have the same analogy and say someone has the right to go and get some grams of cocaine from BC cocaine branch of the Ministry of whatever it is?
I mean, if they're this is it. Like this is what the world's turning to, making it okay. Like alcohol, yeah, you have the right to have a drink, and it's in socially acceptable places like bars, and they want to compare that to safe spaces like using heroin and this and that. I mean, back in my day, we called them shooting galleries, but I just kind of feel that we try to find ways to sugarcoat it or make it acceptable when
Yeah.
I feel like, how am I going to influence the next generation? Cocaine, you can drink and alcohol, just don't get in your vehicle. How many people get in their vehicle? They think they have the right to drink, they're impaired, they start driving, they think they're okay, they're not okay. So when someone wants to use cocaine, it's a really strong drug. It strips you from anything of your own dignity, and you'll do anything for the next hit, anything.
Dr. Emrul?
I'm going to wear a professor hat first. So I think what we need for the audience also to differentiate, and I want to learn from the panel too, because I'm not an expert, of the difference between decrim and legalization, right? So it's very different thing. To me, the decrim removes criminal penalties for possession, but the drug still remains illegal,
Yes.
right? So we pretty much say this is a health issue, not a crime. And on the other hand, legalization maybe builds a legal regulated market. It might be taxed and there might be some revenue for the government too. Those revenue could be used for better public safety or health policies, etc. So we want to clear the blur first, right? Are we talking about decrim or legalization?
At this one, I think we're actually at the stage of legalization, because the analogy that I had now has passed that decrim side, and now it's the side of who has access to it and whether we want to have that access at scale. Erica, what do you think?
Yeah, I think like even if we lived in this like fictitious world where we could stop people from using substances, I don't agree that we should do that. Humans have used drugs throughout all of time, so I think you're never going to stop drug use, and it's clear the approaches that we have used, like prohibition, doesn't result in people stopping their drug use. Like people will always use drugs. And I think people have a right to access drugs in a safe way. And we very arbitrarily have chosen which drugs are illegal and which drugs are legal. I would say the choice of which drugs are illegal currently is really reflective of colonialism and racism.
I was going to ask, how much do you think it just goes back to historical racism that both in the US and in Canada we've experienced? I think that there's a good merit when it comes to marijuana, at least. Yeah,
totally. So like specifically in the Canadian context, the Opium Act of 1908 is interpreted to be the root of our current drug laws. And that was enacted in response to anti-Asian riots in Vancouver to criminalize Chinese immigrants who were working on the railroads.
Yeah.
You know, you're working on the railroad, your body's sore, so you're going to use opiums in order to continue working to make money, to send money back to your family. Like, it was really racist in its roots. And we see the exact same thing in the States with the Nixon administration. Like, you see people coming forward, I forget his name, like John Ehrlichman coming forward. He has like a very famous quote where he was like, we knew exactly what we were doing when we were criminalizing rock and weed. It was to target, weed was to target the hippies protesting Vietnam, and rock was to target Black folks. So I think our current system of how we've chosen which drugs are illegal is very arbitrary and very racist in roots. And I think people who use unregulated drugs deserve to have the same access to a regulated supply like people who use tobacco. Yeah, maybe I'll just end there.
So a couple of things coming back to, I do agree with what Erica just said in terms of our drug policies and looking back and you know, looking into the States, what they've done and how they've done it. We're copying it in a different way here. But going back to Amanda, I've had people die in my arms. I've watched people die. I've administered naloxone. I've done all those things repeatedly, and it takes its toll on you. So when you start thinking about alcohol, and a lot of police officers are addicted to alcohol, that is their way of resolving the things they've seen, their day-to-day trauma and their day-to-day hurt, and that's how they turn to those things. So when we start talking about personal versus collective, I think there's it's a very delicate ecosystem and a delicate balance. I have a right to be free and safe, and I have a right to use drugs if I want to, if it's what's going to make me feel better. But do I, as a collective, do we want to see people injecting in parks? Do we want to see them passed out on our streets? They're human beings. They actually, and I took some notes down here, but they actually have, these individuals should have access to support without fear of arrest, public safety. Policies must consider those risks, such as increased youth access, drug toxicity. We haven't even touched the toxicity. Mm-hmm. We hear the words safe drugs all the time. I don't think there's such a thing as safe. Again, safe is what you think it is, right? But I do want to just shift real quickly here to the economics. There was a study done here at UBC by a professor, Dr. Julian Summers, 5-7 years ago, looking at the 3 blocks in the downtown east side. That was Main and Hastings, and 3 blocks around it. And it worked out to about $1.1 million a day were being put into our healthcare, our hospitalization, our policing, our firefighters, our nonprofits.
Per day.
Our needles per day.
1.1.
1.1 million a day. And that was.
And that's just for 3 blocks.
For 3.
Yep.
Congratulations.
Of those that were addicted and living down with the unhoused. So where can we shift that money to? How do we shift that money? And when we start talking about decriminalization, legalization, your question about where we at, I also think it has been about poor communication by government. When you start talking about decrim, people think it's legal and they can use it anywhere and everywhere, and that's why you end up with some of the policy being walked back about public use and open use in public.
That number that you just said, it just blew my mind. This is basically, we're talking about 3 blocks in Vancouver. The cost of healthcare and everything is almost $500 million per year.
A drug addict that has now developed an abscess that becomes infected requires an amputation. That was $65,000 back then to do that. $65,000 to treat that infection. Think about what we were seeing downtown in Vancouver, right? So I'm going to find that study for you and send it to all of you because it is overwhelming. And that was 5 years ago. Think about
there's so much disease and trauma, and
this is, oh my God. Anyway. Speaking of that philosophical part of it versus like what's happening on the ground, I remember at some point I sent an email to you, Erica, and I was like, can we talk a little bit about the legality side of it? And one thing I've realized was that, if I'm intoxicated and I go to a BC liquor store and I want to have a transaction, I want to get a bottle of vodka, then based on the contract law, because that transaction must be abiding the contract law, it seems like to me that this is not a legal transaction because I don't have the legal capacity at the time because I'm intoxicated to get that bottle. Now, if we translate that into hard drugs, what's going to happen is it's not just going to be all people who are showing up there that they have the legal capacity to conduct that transaction. You're going to see many people that are intoxicated showing up and want to get a dosage of whatever. In and of itself, I think we either have to do something with the contract law, which I don't think we want to do that, just to legalize hard drugs, or we just have to understand that, you know, if you show up there intoxicated and the cashier there sees you in that capacity, there's not going to be a transaction. Then what's the whole point of talking about legalization at the end of the day? Because it seems like to me that a majority of people who show up will be intoxicated or they're addicted. And if we want to say they're addicted, it means that, you know, on the mental health side, they're not in the legal capacity to get that, item that they want to get.
Yeah.
So.
And something good to think about is like, how would we envision the legalization of illicit drugs? I think the kind of first thing within the alcohol realm, I don't think alcohol, the way we have regulated it, which is like allowing commercial promotion, like we allowed advertisements, like alcohol is like so part and parcel with our society. Like that to me is not the goal of regulation. Mm-hmm. Like to me, the goal of regulation is more like what we have with tobacco. And so I think we can envision like lessons learned, you know, like we can control the packaging, the purchase price, where people get it. You can have licensing requirements, you could have doctor's notes. So there's a whole range of different tools government has when you think about regulating something. So I think compare it to alcohol, I think alcohol is kind of like, in terms of public health harms, like the most amount of harm, because you really don't have strict regulation. And coming to like the intoxication piece as well, like within like alcohol sales, like you're not technically supposed to sell to somebody if they're intoxicated. Of course, that obviously is going to happen as well, but I think there's also room for recognition that different drugs affect people in different ways. Mm-hmm. The effects of crack cocaine are going to be very different than the effects of alcohol, and those effects on cognition are going to be different. And you know, if somebody is a chronic user and uses every day, like they might not be as acutely intoxicated as somebody who's like having their first cooler for the first time, for example. So I think there's like a lot of nuance that like we can get into when we talk about like regulation and what that could look like. I don't know, does that help answer your question?
To some extent, yes, especially the fact that you said, you know, we also have to recognize that different drugs come with different level of impact on the individual's life.
But on the first responder's life, I've never had to fight anybody that's high on drugs. I've fought people that are drunk many, many times. They're more violent than anybody that's used drugs in my entire 31 years. So the front responders also is a different approach to someone that's using cocaine or someone that's using alcohol, and how
so
we
that
respond
definitely should be part of the conversation when we're talking about the intoxication part of it. Yeah, go on, Amanda.
Well, like, so I come back and forth. Like I love like hearing everyone's perspective and the research and their own experiences, and also a person with lived experience myself. You know, someone like me who's lived through addiction, trauma, and criminalization, not being arrested for possession is a relief, sure, right? It means I'm not looking over my shoulder every day worrying about being handcuffed or jailed for something. That's part of how I cope. In this sense, decriminalization feels like freedom in that sense. I also wrote, but freedom from arrest doesn't mean freedom from pain. I'm still dealing with the trauma that led me to use. I'm still navigating poverty, unstable housing, and mental health systems that often turn me away. Decriminalization didn't give me a place to sleep. It didn't help me access culturally safe care or rebuild trust with the system that once punished me. I also spoke to, if we stop at decriminalization without addressing the root causes, trauma, colonization, poverty, racism, and the lack of services, then all we've done is shift the surface. It's like saying you're not a criminal anymore while leaving people to suffer in the same conditions. Decriminalization needs to be part of a broader response rooted in compassion, healing, and equity. Otherwise, it's not liberation. It's just a different kind of neglect. That's what I wrote. That's how I feel about certain things. I want better for people. I love that. You know, if we can connect with people and you know, give them safe places that offer them, You know, I look at harm reduction as part of recovery-oriented systems of care, right? We need both. And it's like finding the gaps. Like we come in this with like these ideas and these hopes and these and the goals and the keys, and yet other things are showing up, right?
see.
There's still overdoses. There's diversion. The people are selling, you know, safe supply medication for the drugs that they want, fentanyl. People aren't getting the doses they need not to be sick. So they're still in low doses. They're still not being monitored right. I don't know. It just opens up the door for lots of different things.
So speaking of, because I also have to be mindful about the time, I want to talk about the policy and law enforcement, and I also want to talk about the Portugal model. I think if we, based on the time that we have, let's just talk about the law enforcement part, and then we're going to take the break, come back, and talk about. We're going to start with the Portugal model, and then we have two more segments to talk about. So we had a pilot program in BC. How did it work out, Galib?
Yeah, well, in a minute or less, as the RCMP national lead on this with the Canadian Association of Chiefs of Police, who agreed to this, the drug users had asked for an exemption of 12 or more grams. The police chiefs were very reluctant to do that, not knowing what 12 grams could do, or, you know, that's trafficking levels, but some people do use 12 grams in a day. So we ended up on 2.5 grams with consultation with governments, but we never asked the users really, how much, what do you need? So we just came up with a random number. We selected random drugs. You know, we chose some of the ones that we thought were more dangerous, and fentanyl, for example, to make sure those numbers were low. But the long-term objectives of decriminalization for policing really were to reduce illicit drug poisoning, overdoses. That was number one, the public health piece, so people dying. Reduce barriers to accessing health services by those who use drugs. We call them PWD, people who use drugs. Reduce structural societal stigma. Reduce health, social, economic harms associated with the criminalization of substance use. Reduce PWD's reliance on toxic illicit drugs and increase access to health and social services, including safer supply. We keep using this word, safe and safer. Increase engagement and retention in treatment and support services. Improve interactions between marginalized populations and the police. That was a really big, important piece for the police. We don't have trust in that community. And really, at the end, was to decrease entry into our criminal justice system by these folks and not to give them criminal records. So that was the long-term objectives of decriminalization. I think we failed in a number of places here.
Two questions here, and this goes back again to the philosophical side of it. Why? And I know that this is going to be taken in a wrong way as well, but why do you want to remove the stigma from an addictive drug? Like, the one thing I want to know is, like, okay, if there's something bad, then if removing that stigma, yes, it helps for the people who are dealing with the addiction, but at the same time, doesn't that open the door for, let's say, a new level of demand from people who previously might have thought that this is a bad thing to do, but now they feel like, okay, there's no stigma. And at the same time, we have this sanitized language that we keep using, and I don't know whether it helps. For example, as you mentioned, safe supply. Safe supply as to if we are following specific steps and requirements to then what we have is a quality drug at the end of the day. I understand this, but when we say safe supply, it feels like, you know, a bottle of Gatorade that you can safely go and buy from a gas station. I don't want that to be that safe, to be honest with you. So as a personal experience, I don't want that to be felt that everyone has access to it no matter what. And you keep using that safe supply and a sanitized language. I don't know to what extent it helps.
I think we can talk about the safe supply, and I'm really curious about the lived experiences and the policy side and the research side here. For me, the stigma piece was really around those that were currently in that space, the vulnerable, marginalized, were afraid to seek out help, feeling that if they reached out for help, they would just be looked at as, you're just a drug user, you're just a junkie, and not getting that support and that help that they needed. That's the stigma. And when a police officer comes up to you and you're injecting in a back lane 10 years ago, you are a junkie, you're on the streets here, and you'd be treated differently. We're trying to change the thinking for the person who's using the drugs and the person who's interacting with the drug user, the substance user, I'll say substance user. So I'm really curious about Amanda's perspective on this.
For
because
sure,
I think
but
as a lived
one
experience,
thing is like, you also have to be mindful about the people on the margins. We, in the economic side, we always say, it's all about the margins. You also have to be mindful about the people just on the edge of getting whatever they want. And if you remove that stigma out of the very real experience that the people with the lived experience are going through, then you might as well have an additional level of people that moving forward, they're going to be addicted. So Amanda,
Yeah,
we're all
I think
ears.
removing stigma is super important, because think about the tradesmen. Think about, I worked in Occ Health, facilitating doctors, policemen, fire culture, teachers. The disease of addiction does not discriminate. And so when people are feeling ashamed and feeling very small, or they have this a role in their community, or a title, or a job position, and there's stigma around it because there's judgment. There's shame, and we want people to be able to get the help that they need, to get the help that they deserve, and recovery is possible for everybody. And I think it will open up doors. When you're thinking of folks downtown, or the sex trade worker who is selling her body for drugs, there's double stigma, there's that shame that comes with that. And I think, like, language matters. Stigma is killing people. There's external shame, external stigma, there's internal stigma, people, how they think of themselves and who they are. And addiction wants to keep you small, it wants you to isolate, it wants you to keep yourself separate. And it's our own narrative that we tell ourselves. And then also, too, how society looks at different demographics, right? And if I'm a junkie, then people are going to say, oh, I'm that person in the back alley shooting dope. But meanwhile, the tradesman's coming home, they're getting their dope. They're not using a safe place because they're different. I'm a working man. Why would I go downtown to go use a safe space to inject my drugs or do my drugs? But yet they will go home and use their drugs, and it may be a toxic supply, and they're dying alone.
I'll just say one thing. Look at all the work we're doing around mental health and stigma, and it's Bell Mental Health Day, all these different things. Why are we not doing the same around this?
I understand that part, but at the same time, I think it's just it's a half measured if you don't think about people that are at risk. And when I say at risk, it means people that are just they're not in the right mental health. They're just going through a breakup. They're, I don't know, bankrupt, whatever. That
a
reason
guy going
could
to
be.
work, wear and tear.
Then the problem is, like, if you destigmatize that experience, how likely they are to get involved. And very short on that topic. Go ahead, Erica, and then there are two questions that we have to cover before we go for the break.
And I think, like, if stigma was a tool to stop substance use, we would have no substance use in society, because we have rampant stigma against people who use drugs. I think a good example would be looking at cannabis. So, obviously, before legalization, there was stigmatization associated with cannabis use, and I would still say that there's obviously a bit now as well, but 8 years after the legalization of cannabis, I feel like we have made moves towards destigmatizing cannabis use, and we haven't seen substantial increases in use at a population level. So I don't think stigma is the tool to reduce addiction or substance use or those sorts of things. And when we talk about the root causes of substance use, it's like poverty, trauma, lack of resources, like lack of familial structures, like support in society, those sorts of things, not necessarily whether or not society considers people who use drugs bad, if that makes sense.
Yeah, fair enough. Dr. Emrul?
On this quickly, I mean, I completely agree with all of you. on that, and I used my example already for that. And coming from behavioral economics perspective also. So I think the communication is the issue here, right? So even the BC pilot that we have done, it wasn't clear to even my community and the people I work around. I mean, you know that I also have a sports league, cricket league. We have close to 1,600 cricketers in 3 years. And we see a lot of this usage among youth and everything at the ground, our umpires report. But we are very proud to say that the more we spend money on mental and physical health, the less and less youth you'll see are using this stuff. Beautiful. And stigmatizing, right, obviously doesn't help. And it doesn't really matter actually. Do you live on the East Vancouver side or you have a PhD in economics? It doesn't matter. People will stigmatize, right? And it happened in my own family because I sometimes move my feet. You'll see I do this anyway. A lot of people does. Yeah. But when I started taking some THC in 2023, right, a lot of my even family members and community people around me, why you're shaking your leg that much? Because they're connecting the THC with my shaking leg, right? But I've been shaking leg throughout my life, regardless. So it doesn't matter whether you live on East Van, you look like a junkie, or you're an econ prof, it doesn't really matter, right? So anyway, that's my 1 minute quick answer to your point.
You bring up how diverse British Columbia is and the communities in British Columbia, and you know, you have a Muslim family, you have a Southeast Asian, they can't go home and talk to the families because you will be cast asunder.
That's so true.
You'll be thrown out of the family.
They cannot. I suffered myself, so I know.
Yeah. One last question before our break starts, and that is that when you think about the BC pilot program, and Erica, we're going to start here with you. What are the gaps that we started with, and we started with some goals, and then when we implemented that policy, the on-the-ground reality was different from what we started with as a stated goal?
Well, I think I was kind of thinking about how to answer this because I think there's so many lessons learned from decriminalization, and within the BC context currently, I would argue that we don't have decriminalization anymore because there's been a reversal. So essentially, decriminalization used to apply to public spaces, which was aimed to protect people who are the most socially marginalized and most in the perspective of law enforcement. And those were the people who were feeling the brunt of criminalization. And so those are the people who we sought to benefit from decriminalization. So when we've done this reversal to have decrim only apply to private residences, essentially you're benefiting the people who didn't need decriminalization anyway. So that's kind of one thing, is we don't really have decriminalization anymore. In terms of lessons, I think the first one is that we just didn't give it enough time. It was a 3-year pilot project. We ended it after a year and a half. If you want to look at these long-term objectives, like reducing stigma, these are things that are going to be decades in the future. So we just really didn't give it a chance to have the full evaluation of it to demonstrate that it was working. What we also did see,
So why do you think that there was so much backlash on a societal level?
Yeah, I think there was tons of societal backlash, specifically in relation to public substance use, which we've always had public substance use in BC, very particularly in Vancouver and the downtown east side. And I think that was used as a tool, and decriminalization was used to blame for a whole range of societal ills. So when we talk about public substance use, the root causes is a lack of safe places to use substances, so lack of access to overdose prevention sites, safe injection sites, those sorts of services, and a lack of housing. So if we really wanted to stop public use, we would be giving people affordable housing, be having access to shelters, SROs, those sorts of things, and we'd be having robust access to overdose prevention sites and those sorts of things. So I think that there's not data to suggest that public use increased during decriminalization. We have lots of anecdotal reports, but I think it's a kind of a shame that decriminalization was blamed for that, because I don't think decriminalization is the cause of that.
What could be the cause of that? Because from personal experience, I'm telling you, I work on the drive, the commercial drive, and it felt different. I don't know how to put it in a way that, it doesn't feel like I'm just claiming something, but from the beginning of the pilot, I've been there till today.
It's poor implementation. That's the answer.
Well, that implementation, that's actually there. That is true. So that could be the gap that existed from what it was planned versus what it was felt on the ground.
Possibly.
Poor implementation is the best way to describe it. We didn't give it long enough. And again, the government promised the police, who are the front line of this, that there will be downstream support. So when you come across someone using drugs and they say they need help, we would give them a phone number. You'd call that phone number, nobody would answer that. Who are you going to call up in Prince Rupert or Prince George at 3 a.m. when you need, that very moment you need that help and you can't even get that help? The other thing is we didn't consult with our marginalized communities, our Indigenous communities in these small towns up in the north. We didn't consult with any of them on, is this going to work for you? Many of those communities didn't want it because they've got their own issues already in play with alcohol and a bunch of other historical things, that this was just one more piece that they could not support. So we weren't even prepared for that. I'll stop there.
Just add on to that. I worked a little bit in Williams Lake as well. Williams Lake, it feels like a hub of like a transit route for
the nations
drugs.
all come
Yes.
there. They come there for everybody does, because in small, it's a big town up there.
Yeah.
You need the food shelter. You need to get your needles. That's the place you come to. And same with Prince George. Those are the communities that are hubs for the nations that are around there. And this is where
everywhere.
they come to.
Yeah. So, and you see like people, I was working there for like 8 months or so, about a year and a half ago. And then this last weekend, I was up in Williams Lake again. The number of people dealing with homelessness and addiction, mind blowing. Like on a personal experience that I've seen on the ground, I couldn't believe that I'm actually in Williams Lake. So, Amanda, the question is the difference or the gap existed between policy goals and the on-the-ground reality. So go on.
Well, I wrote, my policy intention was replace toxic street drugs. On the ground reality, I wrote prescribed dosages often too low for fentanyl users. Improve safety and reduce harm. On the ground reality is safe supply not available in most communities. Policy intention, I wrote support autonomy and dignity. On the ground reality is high barriers to access trauma-informed settings. Integrate care, I wrote lack of housing, mental health, or recovery integrations. So yeah, I think these are just on the ground realities to me, and just seeing where we're learning lots of different lessons. Also my decision why I left BC 2 years ago to come out here to Edmonton, to Alberta, and to be part of the Alberta recovery model, right? And I like how we're doing things out here in Alberta and helping people and reducing.
What are the differences between what you see here there in Alberta versus the BC pilot program?
Well, so if I compared the model, the BC pilot program to Alberta model, these are a couple of philosophies I wrote down. We focus on abstinence-based recovery, emphasizes recovery capital, the personal, social, and community resources people need to get and stay sober, strong alignment with treatment, detox, and long-term rehab, where people are getting the help that they need. Alberta's paying for treatment. We have therapeutic communities. Where I got the BC pilot here, it focuses on harm reduction and public health, removes criminal penalties for small-scale drug possession. It prioritizes reducing stigma, overdose deaths, and barriers to support. I can go on more, but
so on the Alberta side, we don't have decriminalization as part of that model.
We have a compassionate type intervention for those folks who can't make decisions for themselves. We want to help them, not necessarily coerce them and take away their rights, you know, because we want people to choose.
At the same time, like if I'm clean and I want to start a new life, and then in my criminal background check shows up something that I took, like, I don't know, 10 years ago, I had like 5 grams of cocaine, and then who as an employer wants to hire me?
Okay, so I'll share with you. I have 2 federal charges of trafficking. I did my time in British Columbia in 2005 to 2010. Full circle moment. I was hired to go back into prisons here in Alberta to implement therapeutic living unit programs for women and men who are incarcerated, and they're called TCs, therapeutic communities. So I was hired. And I think, you know, having my lived experience, also going back to school, publishing things, earning an education, having amazing people who are mentors who brought me to this place allowed, and I came from the gutter and I fought my way through and I found a life worth living. And I believe in community, social learning, social belonging. I found a place, and it's not necessarily that recovery saved me. It's the people that believed in me, to believe
That's
in
so true.
myself.
Yeah.
There are tens of thousands, sorry,
Yeah, go on, go on.
there's tens of thousands of Canadians that have a criminal record for possession of pot. They can't even go to Disneyland. They won't be allowed to cross the border. That's where that stigma comes in. The border, I'm thinking internally in Canada, we're forgiving people. We understand that we've gone through so much, and we will forgive someone who's got a drug record, maybe not murder or sexual assault, but the border is not forgiving. These Canadians can't even leave Canada to go do something because they've got a criminal record on there that we gave
So
them
I
for
think
a
that
joint.
decriminalization part.
It's kind of ironic before we finish this segment. I thought that I was very supportive of decriminalization, legalization, and regulating overall. But then as we started talking, it felt like I'm the one who's more on the conservative side. But it feels like to me that decriminalization, regardless of what you want to do on the next steps, is a very important step, whether you want to take to the rehabilitation process, and after, you know, someone is clean, you want to make sure that they have enough support on a societal level. And Amanda, I think your case is one of the most extraordinary cases that, you know, you're a publisher, you have done amazing work on the ground, and that in and of itself is a great value added to what you're doing. And I guess, although yes, that's a great point that you've mentioned as on an anecdotal level, but I don't think everyone would have that opportunity to be a great publisher and a counselor. If someone wants to, I don't know, go become a chef and having a criminal record under, I don't think it's gonna.
A lot of chefs are drug addicts.
There you go.
A lot of them use drugs.
There you
I
go.
know that.
I think the thing, though, is that when people change their life and there's credibility and they come back into society and become a member of society, self-supporting, you find yourself in places with people who bring you along the way. So if you want to be a great chef, and there's soft handoffs here in Alberta. We got recovery coaches. We have living sober houses. I managed a little bit at 8 Pillars. If you want to look it up, we did the recovery capital. We help men and women get resumes, go back to work, go back to school, integrate with their families, and they get to be in places for a couple years to recover their lives. It doesn't happen overnight.
Yeah.
And there's people who are on medication and they're taking their medication, or part of it's self-responsibility. It's a responsible agency. And this is where we have to start taking some personal responsibility for our lives and the things that we choose and who we want to be. Right?
That is so true. On that personal responsibility side, I think it's a good time to take a break and take some, personal responsibilities taken care of, and we'll
Coffee.
we'll be back.